Are you familiar with that feeling of uncertainty when you leave the dentist's office? You think, damn, something's not right. I think many of us have experienced this ourselves. This often happens in the situations I'll describe next. Anyone can encounter this. But not everyone knows how to get out of this situation without making mistakes that could harm their teeth. At the end, I'll share a life hack on how to get a consultation from 10 dental clinics at once without even leaving your home. The first procedure I would never do to myself is tooth filing. Back in 1995, during a regular training session, just a daily sparring match, I got my front tooth knocked out. Unfortunately, the tooth was broken so badly and so deep that it was impossible to restore it. They removed the remains of that tooth. For a while, I had to wear a real butterfly prosthesis or a median prosthesis. I know what that's like as a patient. I wore that prosthesis for about 2 years, and then I decided to do something to restore it. And back then, the only alternative was crowns or bridges. That is, it was necessary to grind down 2 neighboring teeth in order to close, let's say, this one tooth defect. So you ended up with a bridge made up of 3 teeth, essentially. What's bad about grinding down teeth? The problem is that we almost completely remove all the enamel, the entire protective layer from them, and our tooth becomes completely defenseless. And of course, such a tooth, unfortunately, can gradually deteriorate even under a crown. And very often, especially if you wear crowns for a long time and don't replace them at certain intervals, the teeth under the crowns get damaged. And sometimes after 10 or 20 years, we can remove these crowns together with the teeth themselves. That's how badly the teeth can be destroyed. Therefore, of course, tooth preparation unfortunately reduces the lifespan of our healthy supporting teeth, the ones we once put crowns on. If the technology of implantation had existed back then, I certainly would never have filed down my 2 neighboring completely healthy teeth. I probably would have worn a temporary prosthesis for a while and saved up some money, so to speak, and then gotten an implant instead. That's why I believe that preparing teeth when you have the option to get an implant is a pointless procedure. The second thing I wouldn't do as a dental patient is how I choose a doctor. I always choose a doctor, so to speak, with my heart. If I enjoy talking to the person, if they're a wonderful individual, then I trust them and don't focus too much on their professional qualities. For me, honestly, a human approach is very important, where the doctor understands me, listens to me, and is willing to have a dialogue. Trust, more often than not, genuinely works real wonders. In other words, if there is no trust, even the most skillful and experienced hands can unfortunately ruin everything for a doctor. And on the other hand, if there is trust, then even, pardon me, the clumsiest hands can work wonders. That's why trust is so important. A doctor honestly can sometimes, well, let's say, make mistakes. The most important thing is to have a dialogue with your doctor so that the doctor can always explain something to you, tell you more, or repeat something again if needed. That is, this is very important. That's why this relationship, this contact with the doctor, I believe, are fundamental things for the quality and outcome of treatment. The third thing I would never do to myself is bone grafting or bone augmentation. In order to place an implant into the bone, the volume of bone on all sides should be, let's say, as even as possible or meet certain parameters, so that the implant is held securely, lasts a long time, and serves you for a lifetime. Bone grafting or bone augmentation is done when we screw in an implant and there isn't enough bone volume on one side. This can happen in the front, in the back, but most often on the top. So we first have to increase the bone volume, add some reserve, and only then can we place our implant. Speaking of bone grafting, there are cases when we can avoid it thanks to the length or width of the implant, because our implants also come in different lengths and widths. They come in different modifications by size, by length, and even by thread type. So the doctor can choose, for example, a thicker, wider implant and a shorter one. In other words, let's call it a chubby implant. And in this way, we can avoid bone grafting or bone augmentation. At the moment, I personally have the following task. To place an implant and a sinus lift is required. And as a patient, after discussing with my colleagues, I have the option to choose a slightly shorter, slightly wider implant. And in this way, in my own case, I can avoid bone grafting or bone augmentation.
So if I need bone grafting, I can talk to the doctor about simply changing the type of implant, and then my implantation will be cheaper? Did I understand that correctly?
You understood me absolutely correctly. Again, the key point here is communication with the doctor. Of course, only the doctor can make this decision, but you can definitely ask this question and it really can save you money. It's not possible in every case, but this model line or range of implants from some companies really does allow us to avoid or choose some alternatives. Absolutely.
Not all implants have this option?
Not all implants have this feature. The fourth thing I wouldn't do is have my root canals treated or retreated by a general dentist who doesn't use a microscope for canal treatment. In other words, I would go to an endodontist, or as some call them, a microscopist. That is a doctor who specifically works with a microscope. Why is that? Because a general dentist who treats root canals, a regular therapist who works without a microscope, only sees what he can with his own eyes. In other words, it's called the naked eye for a reason. But if we're talking about a microscopist, just imagine there's a tenfold magnification. The doctor can see in the finest detail what is happening inside the canal, almost all the way to its very end or to the very tip. And all the anatomical nuances, believe me, everyone has their own. Sometimes the canal is curved, sometimes it's hard to pass through, and sometimes an old instrument was left inside the canal from a previous treatment, from a long time ago. That's why only a doctor who works with a microscope can treat the canal with the highest quality, the greatest precision, and with a guarantee.
So basically the main difference here is just that the microscopist can truly see the canal, and that's why they are able to treat it better, right? Or are there some other nuances as well?
If you watch some videos on YouTube or elsewhere on the internet, you'll see just how much magnification there is, how the doctor working with a microscope can see not only the entire canal, its length, how passable it is, but most importantly, all the details. Because during the preparation of the canal, our task, a very important one, is to thoroughly clean out the entire canal.
And in general, the canal, when exactly does it need to be treated? Is it when the nerve has already been removed?
Either when it's being removed or has already been removed, yes.
And when it's being removed, is there pus in there or something?
Our goal is to thoroughly clean the canal all the way to the bone. So the canal is actually bone, and the goal is to remove all the biological material from there, like the blood vessels and nerves. Really clean it out thoroughly.
And what happens if you don't clean it completely?
If you don't clean it completely, it will get inflamed later. Some particles, let's say a bit of our tissue, will remain there and it can become inflamed.
So it will hurt, and then you'll have to treat it again.
And you'll have to retreat it. Not only will it hurt, you'll have to retreat it again. That's why it's important to thoroughly clean out the canal, to remove, let's say, our nerves and blood vessels that were originally there. And it's the same thing when retreating a canal. So it's important to clean everything out, so to speak, down to the bare bone, right? Everything needs to be removed from there using special instruments, either manual or more often nowadays mechanical ones, and then the canal must be properly obturated, or in other words, filled with a special material to ensure complete sealing of the canal. Only after that is the filling done.
And what if the canals are curved? I mean, am I right in thinking that they're not always straight, like in the pictures? And if it's curved, how does a person see inside? I mean, is it like looking through a magnifying glass or something? You can't exactly look around the corner, can you? Is it really possible to see like that?
Of course, you can't see around the corner if the canal is really curved. There is special equipment that allows us to measure the length of the canal. And of course, by first measuring the length of the canal, the doctor understands how long it is and inserts the instrument accordingly, not any deeper. So, thanks to these measuring devices that help determine the canal's length, the doctor will never go beyond it. The fifth thing I wouldn't do is extract a so-called hopeless tooth. What is a hopeless tooth? Is when you come to the dentist and the doctor says, that's it, extraction is the only option. And I personally, as a patient, would still get a second opinion, maybe even a third. In other words, at the very least, I would visit 2 or 3 more dental clinics or see 2 or 3 more specialists, show them my tooth and ask if it could still be saved. Not every case can be saved, of course, but sometimes you can discuss with the patient how much longer we can extend the life of this tooth and whether it makes sense to do so. But personally, as a patient, I would fight for every one of my teeth. Every doctor has their own experience, their own perspective, their own attitude, and most importantly, their own tactics and strategy for treating patients. Therefore, if your goal is to save the tooth, consult a few more specialists or get a few more opinions. Simply put, if that's your goal, it's better to find out all the details. Because sometimes really all the doctors will explain both the guarantee for the tooth, which in fact can be saved, and they'll tell you, we can save it, but the guarantee is only this much. Secondly, they can explain the prospects or the advisability of treatment. They'll say, yes, we can save it, but in a year or 2 you'll have to remove it anyway. And all these nuances are important just for yourself as a patient to accept and think over, analyze, and then decide whether it's enough for you to keep this tooth for another year and leave it as is. But as a patient, I'll say it again, I would fight for every tooth. And of course, I would weigh all the pros and cons before deciding whether to remove it or not, but I would still try to save it.
That's actually a really great piece of advice, because even from my own experience, you go to one dentist to treat a tooth and they'll tell you there's not much point in treating these canals. Well, or rather they need to be treated and then you have to get a crown put on. But I don't really want to get a crown because I'd like to keep my natural tooth for as long as possible. You go to another one and they'll say, it's all fine, let's just fix it for you. And that's honestly a cool tip that I'd really recommend viewers to use and not just ignore.
It doesn't depend on the doctor. It doesn't mean the doctor is good or bad, or God forbid that the patient is good or bad. It's just really different perspectives and different approaches. So here, once again, I want to say that it's important for the patient to weigh everything themselves. And what we can say is that patients today, even with all the modern technologies and everything that exists in dentistry now, especially in diagnostics and approaches, even with all of that, you really can get completely opposite opinions about the same situation. Just don't be alarmed by this. It's normal. It's not because the doctor is bad or unintelligent or smart. There are also situations when the tooth is already gone or it really can only be removed. In such cases, the best option is implantation. If you want to consult on this issue, write to me on WhatsApp. We'll consult you remotely. I promised at the end to share a tip with you on how to get a consultation from 10 dental clinics at once without leaving your home. If I needed a dentist consultation, I definitely wouldn't go to clinics in person for consultations. I would get a 3D scan and send this scan to several dental clinics at once by email. And I would definitely describe my problem, explain my complaints, and most importantly, I would state what I want, what my goal is. In other words, what I'm complaining about, and then calmly wait for a response from the dental clinics. Of course, I would respond. I'm telling you this absolutely honestly. I would choose the dental clinic that responded the fastest, most attentively, and with the most care and concern. And for me, that would already be a deciding factor in whether or not to go to that dental clinic. This way, you can send your inquiry to an unlimited number of dental clinics without even leaving your home. Basically, as they say, while sitting on your couch. If you send your 3D scan, which is your digital file, to several dental clinics at once, you'll save yourself many valuable hours of your life. Don't forget to like and comment. I would really appreciate it.